Hey everyone, it's Danielle. I just finished my fourth shift as a medical scribe at Mount Sinai South Nassau, where we'll be starting my family medicine residency in July. Today, I want to share with you a very specific example of why EMR, electronic medical record documentation, is so important. So today, I helped write a note on a patient who, like majority of the patients on the floor, has COVID and is very sick. Today, the patient had very high blood pressures, and while trying to take down the sedation of the patient, which is a thing that's done every day in the critical care unit to make sure patients are responsive and to see how their clinical course is progressing. So this patient's blood pressure went up, so we decided to give a certain medication to help decrease the blood pressure, which worked. However, later in the day, the nurse approached me and said, "Oh, the patient's blood pressure is now much lower. It's 107. So is it okay if you put a hold parameter on the medication so that I don't continue to drop this person's blood pressure?" So what a hold parameter is basically it tells the nurse who's administering the medication, don't give the medication if this certain condition is met. So in this case, I ended up talking with the doctor, and he recommended that if the blood pressure, systolic blood pressure, was less than 120, to hold or do not give the medication. So I was then able to put in the electronic medical record that give this medication, except if the systolic blood pressure reads less than 120. So then the nurse was able to state in the EMR that she didn't give the blood pressure medication as scheduled because it met that exception parameter, that hold parameter. So that's important so that we have a record going forward, so that tomorrow, if there's a new nurse, a new doctor, a whole new team taking care of the patient, they could see in the electronic medical record, oh, this person's blood pressure is less than 120, so we shouldn't give them medication. And it's important to have that kind of consistency in day-to-day care, and then you can evaluate maybe if this person's blood pressure hasn't gone up for the past day, hasn't needed that medication for the past day, you've been holding it, you could just discontinue it, because what's the point of continuing to order it if you don't really need it? So today, I feel like in that small way I was really able to affect change, which felt nice, and I hope to continue that as this goes on.